So why Jacardi is so important for Slovenia? Because in Slovenia, we do know what is the problem in managing diabetes burden. For example, we know that there are quite some people with undiagnosed type 2 diabetes. And we do know that those are not the patients that usually come to the door of our outpatient clinics, but are living in special environment, in special circumstances. So one pilot project in Slovenia for Jacardi, within Jacardi, takes the advantage of this international surrounding and builds the approaches and means how to invite those people who usually don't go to the prevention visits to do that. On the other hand, for people who already have type 2 diabetes, we know that they don't go and they don't attend educational programs at primary care as much as we would like them to do. Why? Is it the problem of the programs maybe? So this is the second pilot project in Slovenia. The third one, we know that preventing blindness is a really important part of diabetes treatment. And we have national network of centers for diabetic retinopathy, but the number of people attending those centers is like 30,000. But we know that there are approximately 150,000 patients with diabetes in Slovenia. Where are they? Are maybe those centers already overburdened with the existing patients? So based on these problems, we joined Jacardi, and which way to go is really easy for us because we do have National Diabetes Plan that covers at strategic level what and how we manage such problems. And we are not just talking about, so not just strategically decide, but we also strategically act. And all these three pilot projects are part of action plans that support implementation of National Diabetes Plan. And one of the activity of these action plans is also National Diabetes Conference. Logically, it's in November. And every year from the beginning of Jacardi, we announce what are the results of the work that has been already done in Jacardi. So what Slovenia means in Jacardi, we can really show that we did know what our problem was. We did know that we don't know how to go on. And with the help of all the stakeholders in Jacardi, we are finding our best way forward. But there is a fourth pilot project in Slovenia that tackles cardiovascular diseases, rehabilitation centers after acute coronary events. And also for these centers, we know that not enough people actually attend them. And the idea of this pilot project is to really develop a harmonized approach across all centers. And it is really a fortunate event that in Slovenia, Ministry of Health already decided to develop national strategy for cardiovascular health in alignment with EU Commission appeals, but also based on the data that we have. So Slovenia in Jacardi can also show how Jacardi pilot project can help the country develop the strategies and action plans also in cardiovascular diseases.